May is Mental Health Awareness Month, a time to bring attention to mental health struggles and reducing the stigma. Joining us today from Urgent Psych is Dr. Sophia Khan and Dr. Asad Mehdi. Thank you both for being here. Welcome to ATL Live.
Thank you for having us.
Yes, I'm really excited about this conversation. Dr. Khan, we'll start with you. Can you tell us about how Urgent Psych even came to be and what the ultimate goal is there?
So we wanted to create an atmosphere where mental health patients were treated with dignity and integrity. And so what we did is we created an empath unit, and what that does is essentially creates an environment where we meet the patient where they are.
When we were opening Urgent Psych, we had two main goals in mind. One was to address the access of care to mental illness in Georgia, and second is to, as Dr. Khan said, treat these patients with priority, with dignity, and not let them wait in the ERs for hours and not get their issues resolved.
Right. That's perfect because, yes, as you and I, we all spoke about this off camera, when you step into an emergency room, you will not be the first one seen, unfortunately. So this is a great option. Dr. Mehdi, let's bring you in here and talk about age limitations for the patients you see. Are there any?
So the patients that we have been able to see can range from 5 to 85 years of age. There are kids who are coming in that have diagnosis of autism, that are getting aggressive. They cannot get in to see a psychiatrist. The children who are struggling with mental illness in the schools, they've been referred to us by their pediatrician or school counselors. And then you have the adults who are struggling with issues like anxiety and depression or substance abuse. They are, can come into our Urgent Psych without any appointment and have a walk-in evaluation at the same day.
That's amazing. I was not expecting you to say age 5. That is wonderful to hear, honestly.
In fact, what we see is 52% of what we see is pediatric population.
Wow. 52%?
52%. We have a separate unit for our pediatric population and a separate unit for our adult population.
Wow.
Yes.
Okay, so my follow-up to that is going to be insurance. Do you need it?
You do not need insurance to be seen at our clinic, but we do take all major insurances, including Medicare, Medicaid, all the managed Medicaids, and if you don't have insurance, we have a competitive rate for a self-pay rate.
Wow. Okay, this just keeps getting more incredible, honestly, as this conversation continues. Dr. Mehdi, can patients stay overnight at Urgent Psych?
So our timings are from 11 a.m. till 7 p.m.
Okay.
Our goal is to stabilize these patients within that time frame. If they need a psychiatric hospitalization, we have a connection with the local psychiatric facilities where we can transfer them within 2 to 3 hours of they're coming in Urgent Psych. So our goal is to stabilize them, not to keep them overnight. And if they need to be in a hospital, then we can get them in a hospital as soon as we can.
Right, help that transfer process. Dr. Khan, lastly here, we really want to help people understand how you all at Urgent Psych treat a crisis situation differently from a traditional hospital.
So I think the best way to answer that question is to tell you that if you went to an emergency department and you had a mental health challenge or crisis, you would be stripped of your belongings, you would be locked up in a room with a sitter who would watch you, and it's a very different approach. What our approach is one that's dignified, has integrity, and you would be with your loved ones. We would be able to evaluate you in a way that's compassionate and really brings to light where we can meet you where you are.
Oh, wonderful.
Yeah.
Thank you both for being here. Really great information that you're sharing. And everyone, if you would like more information on Urgent Psych, you can visit urgentpsych.com. Thank you again.
Thank you.
Thank you.